Health. Hello everyone, welcome to the Lancet Summary YouTube channel. I'm Dr. Armin Khavandegar, a medical doctor and medical researcher. Here we are with Dr. Payman Salamati, a professor at Tehran University of Medical Sciences, specialized in the field of social and preventive medicine. In this YouTube channel, we are going to summarize medical hot topics recently published in the Lancet Journal. Dr. Salamati, what topic are we going to discuss today?
Hi everybody, thank you so much Armin. It's my great pleasure to be here and introduce a new paper called Social Determinants of Health, the Need for Data Science Methods and Capacity. The type of the paper is a comment and it was published in April issue of the Lancet Digital Health Journal.
So, could you please tell us a bit more about the exact definition of social determinants of health?
Social determinants of health include forces, systems, and conditions that shape the environments in which people are born, live, grow, work, and age. Let me provide another definition from WHO. It says, social determinants of health, or SDH, are non-medical factors which influence health outcomes. And to me, I can change it a little and I can say non-medical factors influence quality of lives, diseases, and deaths.
Would you mind elaborating a bit on non-medical factors?
For sure. Please pay attention to the picture and you can see an iceberg. Of course, you see the tip of the iceberg. However, there are a host of different items underwater, and you see that the larger part is under the water, and it shows that it's more important. And also you can find the more distal the items are, the less the items can be changed easily.
From distal to proximal, these determinants and items are assumptions, values, beliefs, culture, personal health practice and coping skills, gender, biology and genetic endowments, social environments, healthy child development, employment and working conditions, social support networks, physical environment, income and social status, education and health services. Are there other classifications for these determinant items?
Absolutely. Please look at the next picture and you can see that at the center we have a circle and we have 4 outer arcs. At the circle we have individual factors that they are not changeable, including age, sex, and hereditary factors. And for first arc, they are related to individual lifestyle factors such as exercise, diet, addiction, and coping strategies. For second arc, they are in social and community networks group such as families, neighbors, co-workers, and social organization. And for third arc, they are living and working conditions, public services and infrastructures like education, employment status, housing, water and sanitation, and healthcare services. And for last arc, they are social, economic, cultural, and political factors such as racism, social cohesion, poverty, and inequality. Although money spent on healthcare systems and humans' lifestyles are important, SDH have greater effects on quality of life, disease, and death.
For instance, as one of the SDH, could you please explain a little bit more about racism?
You know that racism is not a medical factor, and we can put it in outest arc among socioeconomic and cultural items. During history, there are many examples that racism could influence quality of lives, diseases, and deaths, and indeed, racism can act through structural and root causes.
While performing research project, we have confronted some sorts of challenges in SDH. Could you please elaborate on it?
There are a couple of different challenges in SDH research. For the first one, it's related to data because for SDH, sometimes we don't have much data or the data are not easily available or there is not a consensus about how we can gather the data. For example, consider racism. How we can find whether there is a kind of racism in a society or how we can quantify the severity of racism in a society. Of course, some experts provided different solutions, but there are a host of various controversies.
More specifically, while statistical analyses have been performed in SCH, they also confronted some sorts of problems either. Could you please explain a little bit on it?
You're wrong. The second challenge is about statistical analysis. You know that for medical factors, the problem is easier. However, for SDH, we have many intermediate and confounding factors which should be controlled. Suppose that we are going to evaluate the relationship between people's income and health outcomes. In that case, you need to control some different items such as physical activities, diets, and health behaviors of those people.
The authors of this study also recommended that the necessity of performing longitudinal research in this field. And what do you think of it?
As you know, longitudinal studies are among some of the best research projects in medicine. In that case, researchers would like to follow different items and evaluate some changes during time, and then they assess the outcomes. In medical factors, the changes happen in a short time, but the changes in SDH need a long time to happen. For example, for racism, sometimes we may need different generations and passing a couple of generations to have some changes in racism in a society.
In summary, what's your conclusion of this paper?
This is a great article which discusses a neglected subject called SDH, and these non-medical factors have more impacts on our quality of lives, diseases, and deaths than medical factors. And based on this article, we could be familiar with some challenges of research on SDH.
Thank you for your time and explanation. Once more, the goal of this YouTube channel is to provide a summary of medical hot topics recently published in the Lancet Journal. Don't forget to like this video, subscribe our channel, and leave your comments below this video.